today we are at Bethel University, and I am joined by Deb, who will be talking to us about their nursing program. Good morning.
Good morning. How are you?
Great. Thank you so much for joining us this morning on Hometown Living. Now, Deb, I'm a little scared. I hear we have blood in the background, so I'm just going to look at you right now. We're just making eye contact.
It's just simulated.
It's simulated.
Okay. Right.
So talk to us about the nursing program here and what makes it so special.
We have a great nursing program here. We have associate degree and bachelor's degree, the master's degree students, and we've had over 2,000 graduates in the last 30 years who have just gone out and they've been able to make a difference in the world.
Wow.
And so we have a great program that is tied for #1 in the state and also tied for #1 in the nation.
Yeah, so go in more details about this program. What does it look like for a student that's majoring in nursing?
One thing that we do is our students actually get 3 years of clinical and time out in the hospital, so that increases their time taking care of patients and increases their confidence level. And so they start at the beginning of the program and they take care of one patient for a 3-hour shift, and by the time they're at the end of the program, they have a team of patients that they take care of, and they're working with the nurse, and they're taking care of 4 or 5 just like they will when they graduate.
Wow, and tell us about the accolades here. I mean, we know the nursing program is special, but go into more details about the accolades.
So we are one of the top programs here in the state. We are top in the country. We have 100% NCLEX pass rates, which is the big test that they take after they graduate. Mm-hmm. They're not an RN once they graduate. They actually have to take a big national test. We rank high with other national organizations, and so we're nationally accredited, and so our program is great.
Yeah.
And you can tell by our graduates that we have a great program.
You know, tell us about the unique opportunities that is offered to the students too within this program.
One of the things that we do is our nursing faculty every single summer offer a mission trip. And so we have been able to take students to Ecuador and Guatemala, Dominican Republic, and Kenya, the Navajo Nation. And so getting to experience what healthcare looks like in the third world country opens up their eyes to how they can, how this local area is also a mission field. And you don't have to go overseas and work internationally to serve in the mission field. We can do it at home.
And why would you say, you know, it's a great time right now to become a nurse?
Oh, there's such a nursing shortage out there right now, and so bringing people in that care for people and love for people and can provide great care is essential right now.
Yeah.
And so there are lots of opportunities. You don't have to work in the hospital to be a nurse. With the boomers, you know, they're getting older, and so they're out in the community health settings, and there are just so many places that you can serve. And so if hospital is not for you, we have 1,000 other places where you could work.
Yeah. You know, why would you encourage someone to go back to school to, you know, get their BSN or their MSN?
It's career trajectory. And so because there are so many opportunities in nursing, you can go back to school when you're ready for a change and say, you know what, I want to do something different. I want to be a nurse educator. I want to give back to the future generations. I want to be a nurse leader. I want to go up. And so that gives you an opportunity to always change and adjust and do something different.
Yeah. You know, tell us more about the hands-on experience that the students get to actually have, because I think I'm going to have the opportunity to meet someone in there next. So tell us about the hands-on experience that the students get to have.
So in clinicals for our BSNs, they get to spend 820 hours in clinicals. And so that is a lot of time taking care of patients. Mm-hmm. We also have a high fidelity simulation here in the School of Nursing. And so they get to practice things that they wouldn't always get to participate in the hospital. And so if there's a code blue, we actually practice it here in our sim lab, as opposed to when I learned it 30-something years ago, and my first one was on a real patient.
Really?
And so, yes. And so it's a safe learning environment. They can make mistakes. It's okay. We can bring them back to life. We always record the simulation, and so the students learn more by watching the simulation and knowing what's going on there and realizing the mistakes that they made. And sometimes we do a do-over. Sometimes we do second part. Okay, if we made this mistake, what would happen with our patient? And so they get to see the consequences of that.
And Deb, what would you say is the best part of your job, seeing your students be able to have these hands-on experience and learning, you know, about becoming a nurse?
Best part of my job is the way that we are able to impact our community, our region. Every single person that we touch here with our nursing students, they go out and they take care of thousands of patients. And so the impact that Bethel graduates have out in the world is just amazing. And they keep in contact with us, and so we know what's going on. And I love getting the updates from them. Yeah. So it's a family here.
It's a family. Well, Deb, thank you so much for joining us this morning on Hometown Living.
Thank you.
Nice meeting you.
Thank you.
For more information on the nursing program and all the wonderful academic opportunities at Bethel University, check out your screen. You can visit their website or you can give them a call at 574-807-7000.